Rachel. I'm Billy. I'm a PA student, and I'll be doing your musculoskeletal physical exam today. I'll start by washing my hands. Would you like some?
Yes.
Coronavirus, am I right? So what brings you in today?
Wrist pain.
Oh, very generic. Sounds good. Well, we'll take a look at that. I'm just going to start by palpating your radial pulses. Feel good. Alrighty, next I'm just going to start by inspecting your hands and wrists. So I'm looking for any erythema, ecchymosis, asymmetry, deformity, or nodules. If you could flip them for me. Perfect. Alrighty, I'm going to start by, which one's the affected one?
The right one.
Okay, sounds good. Alrighty, so I'm just going to start by feeling your joints of your wrist and your fingers, feeling for any tenderness, heat, nodules, or crepitation. I'm going to do the same for this one. Same thing, just feeling any pain with any of that.
Nope.
Alrighty. Now I'm just going to check the bony landmarks of your hand and wrist. So you can come a little closer. So we have your distal ulna, your distal radius. If you flex your hand like that for me, your thumb kinda, is your anatomic snuff box. We have your carpals, your 5 metacarpals, your MCP joint, and then your distal interpharyngeal joints, your proximal pharyngeal joints, or your PIPs, and then your phalanges, so your distal, medial, and proximal. Perfect. I'm just going to do the same thing with this hand. So again, the distal ulna, distal radius, flex your thumb, anatomic snuff box. Any pain with that?
Nope.
Carpals, metacarpals, your phalanges, your MCP joints, DIP, and PIP joints. Good. Everything looks great. Alrighty, moving on to some active range of motion with your wrist and hands. So we're going to start by flexing our fingers, extending our fingers, abducting, adducting, thumb. This is abduction, adduction, flexion, extension. Good. Now opposition, touch your fingers. Good. We're going to have wrist flexion, wrist extension, and then ulnar deviation and radial deviation. Good. Any pain with any of that?
Nope.
Alrighty, perfect. Next we're going to go on to some special hand tests. So I'm going to start by doing the Phelan's test, which is to assess for carpal tunnel syndrome. So I'm going to have you doing your hands like this and just push against your wrists. And we're going to do this for 60 seconds because this is the same test. We also do this test for the cubital tunnel syndrome of the elbow. And the only difference is that when assessing for carpal tunnel, you hold it for 30 seconds, but when you do it for cubital tunnel, you do it for 60. So we're just going to get feed 2 birds with one scone. That's the phrase we like to use in the program. Alrighty. Any tingling in your fingers?
Nope.
Alrighty, good. Next we'll do the Tinnell's test to assess for carpal tunnel. I'm just going to tap on right over your carpal tunnel a couple times. Any tingling in your fingers?
Nope.
Good, we'll test this hand just to be sure. Same thing. Any tingling?
Nope.
Perfect. Moving on, we will do the Finkelstein test to test for de Quervain's tenosynovitis, which is inflammation of the abductor pollicis longus and the extensor pollicis brevis tendons. So what you're going to do is you're going to put your thumb inside your hand like this, and I'm just going to ulnar deviate down. Any pain with that over your snuff box?
Nope.
Good. And then the last test we're going to do for the hand and wrist is we're going to do the Frohman's test to assess for ulnar reticulopathy. So what I'm going to have you do is grab the piece of paper, between your thumb and index finger like that, and now don't let me take it away. Good. Other hand. Don't let me take it away. Good. And I'm checking for compensation and thumb flexion, but I didn't see anything. All right, next, before we go into the more specific elbow and shoulder exams, I'm going to do some strength testing. So we'll start with your shoulders. I'm going to have you straighten your elbows for me, and now go ahead and push against my hands for shoulder flexion. Pull back, shoulder extension, put your arms to your side. Push against my hands for shoulder abduction, and against for shoulder adduction. Good. Next, I'm going to have you flex your elbows. And I'm going to have you pull towards your shoulders for flexion, elbow flexion, and down for elbow extension. Good. Next, we're going to do the wrists. So I'm going to have you push down for wrist flexion and push up for wrist extension. Next, we'll do grip strength. So I'm going to have you grab onto my fingers and hold it, squeeze as tight as you can. Good. Next, we'll check for thumb opposition against resistance. So I'm going to have you try and touch your pinky. Good. Other hand, touch your pinky. Good. And finally, we're going to do the abduction and adduction of your fingers against resistance. So we'll just do one at a time. So we'll do abduction. Good. Good. Spread apart. AB. Other hand. Spread apart. Good. Spread apart. Good. Spread apart. Good. And then we're going to push together for adduction. So push together. Good. Push together. Push together. Good. Push together. Push together. And push together. Good. So your strength is intact bilaterally in all joints. So that's great. Moving on to the elbow. I'm going to start by inspecting the elbow, looking for any erythema, ecchymosis, swelling, nodules, deformities, asymmetry, all that fun stuff. I'm just going to have you relax, and I'm going to bend your elbow here, and I'm just feeling the joint for any tenderness, heat, nodules, or crepitation. Any pain with that?
Nope.
Alrighty, good. Next, you're going to feel for some bony landmarks. So you have your olecranon, you have your lateral epicondyle, your medial epicondyle, your cubital fossa, and your radial head. Good. Next, we'll do some active range of motion with your elbow. So again, flexion, extension, straighten it all the way. Perfect. And then pronation, supination. Any pain with any of that?
No.
Good. Moving on to some special tests at the elbow. We'll start by doing the valgus stress test. So I'm going to hold your arm at about a 30-degree angle, and just going to have you relax. I'm just going to apply some valgus stress. Any pain?
Nope.
Okay, good. Then we already did the Phelan's test for cubital tunnel syndrome. And this was to test for ulnar collateral ligament laxity, the valgus stress test. We already did the Phelan's, and so we'll do the Tinel to assess for cubital tunnel syndrome. So the same tapping motion that I did on your wrist. So just gonna tap a little bit in here. Any tingling in your fingers?
No.
Awesome. Next, I'm going to do some tests for medial and lateral epicondylitis. So we'll start with the medial epicondylitis. So I'm just going to palpate for any tenderness of the insertion of the common flexor tendon in the medial epicondyle. Any tenderness?
No.
Alrighty, I'm going to have you resist against flexion. So, resist against flexion. Yeah, good. Alrighty, and then I'm going to have you fully extend your wrist all the way and then straighten your elbow. Any pain in here?
Nope.
Good. Next, we'll test for lateral epicondylitis. Again, palpating for any tenderness of the common extensor tendon in the attached to the lateral epicondyle. Any tenderness?
Nope.
Alrighty, I'm going to have you resist against extension. Good. And then for this one, I'm gonna have you fully flex your wrist and straighten your elbow. Any pain in there?
No.
Perfect. Alrighty, that completes our elbow exam. Moving on to the last and final joint is the shoulder exam. So I'm just noting the contour of your shoulder. Looking for any erythema, ecchymosis, deformity, asymmetry, swelling, or nodules, or muscle atrophy as well. So I'm just going to start by palpating. I'm just feeling your shoulder for any tenderness, swelling, crepitation, nodules, moving down, just feeling how it feels, any heat. I don't feel anything, good. Next I'll focus on bony landmarks. So we have this subclavicular, or the sternoclavicular articulation, the acromion clavicular articulation. We have the subacromial space, the biceps groove, and then the insertion of the supraspinatus tendon, all that supraspinatus tendon, all up in there. Okay, everything feels like it's intact. I'm gonna do some active range of motion. Gonna go ahead and put your arm at your side, do flexion, extension, good, abduction, adduction, and go ahead and bend your elbow for me and do internal rotation and external rotation. Awesome, any pain with that?
Nope.
Perfect. We're gonna go ahead and move on to special tests of the shoulder. We'll start by doing the Hawkins or Kennedy impingement testing to assess for supraspinatus tendonitis. So I'm going to have you lift your arm, bend it for me like this, and go ahead and, or actually I'm going to do it for you. And we're just going to go ahead and cross the body. Any pain or weakness with that?
Nope.
Perfect. Next we will do the, gosh, there's so many tests. We will do the Gerber sign or the liftoff test. So I'm going to have you kind of turn your back, and this is to assess for subscapular tendon pathology or atrophy. So what I'm going to have you do is put the back of your hand against, just turn your body a little bit, yeah, perfect. Put the back of your hand against, and I'm going to push against your hand and try and lift your whole arm off. Perfect. Any pain or weakness with that?
Nope.
Good. Moving on to the empty can test to assess for supraspinatus involvement. I'm going to have you put your hand out, tilt your thumb upside down. Wow, it's almost like we practiced this. And I'm just going to push down, and so resist me pushing. Any pain or weakness?
Nope.
Perfect. Next we'll do the crossover test to assess for AC joint deformity or pathology. So what I'm going to have you do is put your arm out like this again and just cross over. Any pain?
Nope.
Looking for grimacing, but she obviously didn't, so that's good. And then finally, for the last couple shoulder ones, I'm going to have you laying with your right arm kind of hanging off the table. Oh, I should have moved the other chair. Alrighty, perfect. I'm going to have you scoot just a little bit more so that your shoulder's kind of off the table. Perfect. And what we're going to do for this is we're going to do the anterior apprehension test. And this is to test for glenohumeral joint instability. Sorry, the sun's kind of bright.
It's all good.
So what I'm going to do is I'm just going to flex like this. I'm going to hold your elbow, and I'm just going to slowly externally rotate your hip, looking for any apprehension or grimacing, which you show no emotion. So any pain with that though?
Nope.
Okay, and then the final test we're going to do is the same. It assesses the same thing, that glenohumeral joint instability. I'm just going to apply some anterior pressure to your shoulder here, looking for any resistance. That's a relocation test. Don't know if I said that or not. Any pain?
Nope.
Perfect. Alrighty, you can go ahead and sit up. Well, that completes our musculoskeletal exam. I suggest icing your wrist because all your tests came back negative. But other than that, I hope you have a great day. Any questions?
No.
Alrighty, thank you to my patient and my camera woman, my mom.
Woohoo.